Driving Change, Biomedic Science Campus Lübeck.
PASBADIA is an acronym for Patient-centric, smartphone-based diagnostics with local and central AI platform for primary care in rural areas. Well, medicine requires often rapid near-patient diagnosis. For example, monitoring the curative course of patients with mobility impairments in rural areas. Current smartphones are suitable for this task due to their widespread use, built-in sensor technology, and computing capacity. Therefore, PASBADIA develops appropriate attachment and applications for smartphones where ophthalmological examinations become possible in primary care setting. The project consists of 4 sub-projects which we present today to you. Well, first of all, let's look at the relevance of the topic. The number of patients with diabetes mellitus type 1 and 2 currently amounts to 7.5 million in Germany. Diabetic retinopathy constitutes one of the most serious complications of diabetes and affects approximately 10% of these patients. Therefore, the adherence to regular eye screening is quite important to diagnose diabetic retinopathy at an early stage when it can be treated. Smartphone-based fundus cameras and the evolution of artificial intelligence may enable this screening in primary care setting, which might improve the adherence.
For example, imagine a couple, John and Lisa. John suffers from a neurological disease that binds him to bed. Lisa has been diagnosed with diabetes mellitus 15 years ago, but denies to go to the screening because she's not willing to leave John for more but an hour. For her, the offer of getting the screening done with her general practitioner suits her very well. The result of diabetic retinopathy showed no DR, so she is confident that she does not need to go to the specialist and can stay with John.
We at the Institute of Family Medicine support the project from an implementation science perspective. Implementation science deals with the evidence to practice gap and thus focuses on the question how to ensure that the best available evidence is transferred into daily clinical practice.
The best technology is of no use if its implementation in the healthcare system is neglected. Therefore, we have interviewed general practitioners, medical assistants and ophthalmologists about the barriers and enablers for the acceptance of AI-supported systems in primary care.
Moreover, we conducted a meta-analysis to determine the current state of knowledge and diagnostic performance of deep learning screening methods for diabetic retinopathy in primary care. The sensitivity and specificity were overall high, with a pooled sensitivity of 87% and specificity of 90%, roughly comparable with ophthalmologists. But nevertheless, the sensitivity and specificity have always to be evaluated with regard to the prevalence.
Human vision is a technical masterpiece of nature. However, the imaging of the retinal structure is somewhat demanding because we have a permanent eye movement, an inefficient backscattering of light, and also a reduction in pupil size when illuminating with white light. But if we now take an image with a white light source, we can get an RGB image of the retina. But sometimes this RGB image with its 3 channels is it's not sensitive enough to differentiate between healthy and pathological structures. And this is the question now is, can we overcome this issue with a technical improvement? And this is where our idea is based on. Instead of a white light source, we're using a multispectral flash sequence. And with the slow motion function of the smartphone, we can extract the single channels of the multispectral light source. The benefit of this is now that we have different light-matter interaction of each single channel. And this interaction enabled us to enhance the color contrast of the images, leading us to a very high precision diagnostic. And this leads us to another important question. Is there any way how we can automatically evaluate these multispectral imaging sequences based on an AI learning algorithm? And this is where the next project is based on, the deep learning algorithm for the automatic detection of retinal disease.
In PASBADIA, we focus on using state-of-the-art deep learning models to evaluate the images captured by the smartphone-based multispectral imaging system to achieve high performance on diabetic retinopathy detection. As for any deep learning-based system that is to be deployed in medical care, several challenges arise concerning the intrinsic black box character and the typical overconfidence of deep learning frameworks. Providing a disease detection algorithm that is both highly accurate as well as trustworthy and self-explanatory, so that general practitioners on the one hand do not hesitate to use the device and on the other hand can make reliable and confident diagnosis, requires sophisticated model design and training. To tackle these challenges, the development of a holistic detection algorithm is pursued in PASBADIA that, in addition to the predicted DR severity grade, computes precise segmentations of lesions being related to DR that are provided to the practitioner to enable him or her to self-verify the prediction of the algorithm. Moreover, to give the practitioner a better understanding of how confident the system's diagnosis is, we aim to implement the model to not only compute a prediction, but also to estimate the model's uncertainty. To this end, we use deep ensemble models and investigate the integration of probabilistic methods into our detection algorithm to further improve the calibration of the predictive uncertainty. Furthermore, embedding the algorithm into our smartphone-based imaging system additionally constrains the available computational power and memory. To overcome these limitations, the computational constraints are already considered at the design stage of our model. We therefore use lightweight and well-performing state-of-the-art networks and adapt them to our needs by further downscaling the models for the number of parameters and the computational complexity while searching for the best trade-off between model accuracy and computational efficiency. Nevertheless, having designed and trained a satisfactory algorithm, there are several additional challenges to be solved how to finally integrate the algorithm into our distributed system.
The question COSA investigates is, how do we integrate the methods and networks presented by Marlin and Malte efficient and reliable into a distributed diagnosis system in rural areas? The system to be implemented consists out of the centralized and decentralized infrastructure, including encrypted connections and self-learning algorithms. As you can see, there are several subsystems as shown in the picture. First, there is a smartphone directly on the subject as presented by Malte. It also referred to as edge device due to the distributed processing nature. On the other hand, there's a central service that provides the system with high processing power and a data storage. Ultimately, the learning success from the much larger database is to be mirrored back into the local diagnostic algorithms in a traceable and verified manner. As you can see, the data connection between the smartphones and the AI processors is realized through a wireless connection in the middle. In rural areas, this connection can become unstable due to radio gaps. The instabilities in the connection can significantly affect the inference latency of the application. And these longer latencies can cause malfunctions due to timing errors and also reduce the battery run times of the sensor system due to the limitations at the edge. We investigate the use of applied AI in edge and cloud systems in terms of technical and energy requirements, performance and data processing to determine the optimal resource allocation and processing location depending on the link.
Thanks to the Joachim Herz Foundation, we have the opportunity to improve healthcare in rural areas in the near future.